Coming up on this episode today, we're talking about the very topical issue of the use of Wegovy, Ozempic, Mounjaro, the so-called fat-busting jabs, and the good, the bad, and the ugly of their use.
Hello everyone and welcome to the Wealth of Health podcast. My name is Ahmed, I'm the CEO of Echelon Health, and with me as always is Dr. Paul Jenkins, Medical Director, endocrinologist and consultant physician.
Hello and welcome again.
Today we have a very, very relevant topic to talk about. The rise of Ozempic, Wegovy and Mounjaro, medicines that were originally started perhaps as as health management tools for people who are diabetic or pre-diabetic, helps them regulate their appetite, maybe regulate their blood sugar, but they became popular for something completely different, which is primarily weight management. So is it worth it? What are the risks? What's good about them and what's not so good? This is what we're talking about today. Paul, can you tell me those medications? And first of all, we have Ozempic, we have Wegovy, we have Mounjaro, and there are about 3 or 4 others, but these are the most famous ones. Mm-hmm. What are they? Are they all the same? Yes and no. And if not, what do they do to the body? Primarily.
Okay. Well, they were first. I mean, they've been around. Firstly, they've been around for a number of years. Yes. Okay. So this class of drugs which mimic a hormone released from the small bowel, a type of hormone called incretin. Okay. They mimic that. They were first came onto the market about 20 years ago. The precursor of it.
Oh wow!
In the treatment for diabetes. Yes, and they're very effective in helping reduce blood sugars. They work by mimicking a hormone, this incretin-like hormone, called glucagon-like peptide 1. They act on the same receptors as that to stimulate insulin release, to reduce glucagon release, which is a sort of antagonist. It blocks or works opposite to insulin. Okay. Yeah. They slow the emptying of the transit through the gut, and they increase the sensation of satiety. So you feel full after eating just a smaller amount. So they're very effective in the treatment of diabetes, but then as part of that, they were found to cause significant weight loss. And that's really where the market has just exploded.
Yes.
Because people for decades, and I've been in endocrinology now for 35 years, and it's always been the holy grail is to get the weight reducing medicine. Yes. Because, we've discussed before, but with the modern diet or processed food, high sugar, and in all developing countries, obesity is the biggest issue. So the market is astronomical for this. We had a similar, analogous when it came out, Viagra. Viagra was originally designed as a relatively modest medication for blood pressure. Blood pressure. Right. And then as they put it on the market, there was this post-marketing surveillance program, yes. And men were saying, whoa, the erections are much stronger, and they became more and more aware of this and suddenly realized, wow, let's do a complete pivot and push this now
as that Viagra instead of what it's intended for. There are so many jokes running through my head, but I wouldn't even go there. Yeah. Okay. But also, Viagra, you can take it and then stop it, or take it on occasions or not. This medication, so it, as a layman, so it affects some enzymes in your gut. It affects the release of insulin.
Yep.
It affects the rate of digesting the food.
Yes, or it affects it slows gastric emptying.
Okay.
So you stay full, you don't get so full quickly.
Yeah. Right.
And it makes you feel full earlier. It works on the hypothalamus, which is the endocrine little part of our brain, which controls many of our really powerful sensations and feeling. And one of them is hunger. So it makes you feel hunger. It makes you feel full and less hungry.
Okay.
So therefore you are less driven to eat all the time, or you eat less.
Okay. So, I mean, this thing is, just to give everyone an idea, the valuation of Novo Nordisk, the company that manufactures Ozempic, is now reached $570 billion. Yeah. They're based in Denmark, aren't they?
Yeah.
Okay, that's bigger than the whole GDP of Denmark.
Yes. It is an astronomical market.
So when something happens that quickly on that scale, I'm always apprehensive.
Well, apprehensive of what?
Apprehensive of, do we have enough research? Is this going to turn into a big problem that we're going to suffer from later? You know, we've had a couple of those things recently. And is everyone saying, well, you know, if $570 billion are on the line, some things are just not going to be said. And it's not even a conspiracy theory. It's just how things are.
Well, I don't know if it will be said. I mean, they are relatively, I said they've been around for 20 years, but Ozempic, Wegovy, which is the same formulation, just exactly the same drug, just packaged differently for obesity or diabetes.
Right, okay.
Yeah. Mounjaro, you know, they've only been used for 2, 3, 4 years. Yes. We will get more and more information on them as the years come by, and the widespread use of them, and for different indications. Yeah. So, so I think we can't say what the long-term issue is. What you can say is that at the moment, you know, and putting it slightly into perspective, in the sales of just Mounjaro, the last quarter of last year, so 3 months, were $3.5 billion.
With a B. Billion.
$3.5 billion on just one medication in one quarter. Yeah, that's not, you know, let alone Ozempic, etc. The total sales of both of those to date are about 25 billion. Right. 25 billion. Put this into context, especially in the UK, when there's this widespread call, they should be all available on the NHS. Yeah, the total NHS budget is 180 billion. That's got the entire population for every aspect of the NHS.
Yeah.
So you're looking at one drug, yes, which is largely, and this is where we can discuss, gets controversial, but is often more and more used for lifestyle and for, you know, wanting to change one's body shape and to lose weight because I'd like to look slimmer.
Okay, so that's a good point. So in my little knowledge about drugs in general, anything that we put into our system that does not naturally belong there has a side effect.
Yes.
However, when we are struck with a certain disease or a certain ailment, it justifies the potentially living with this side effect because the benefits of the drug outweigh the risk.
Yes, completely agree.
Okay. Now, using that, and we're going to talk about the side effects from these drugs, using that as a weight loss, and I'm not judging it, the question in my head that pops up immediately is, is it then worth the risk? Because the side effects that I've been reading about, have some information here. So Mounjaro, Wegovy, and Ozempic, this is US data primarily. I couldn't find much data here in the UK. Yeah.
Same.
So that's at least 162 deaths since 2018, according to reports by the US FDA. And they also received, and this is a self-reporting portal, so these are the people who decided to report the side effects. At least 62,000 reports of side effects linked to drugs such as Ozempic, Mounjaro, and Wegovy since 2018. About 10,000 of these cases were listed as serious, meaning the patients who experienced side effects from these drugs was hospitalized or experienced life-threatening complications because of the side effects linked to these drugs. Is it worth it then?
Well, when you're talking of, you know, side effects, I think we should probably go a couple of steps back and recognize that any medication can have side effects. If you put anything into your body, it can have a potentially serious side effect. Even something as simple as aspirin or Nurofen, ibuprofen you take for painkillers, that can cause severe gastrointestinal bleeding. You know, we've all medics will have come across cases of that, of severe life-threatening bleed in response to that.
Yeah. Is it rare, though?
Yes, they are rare, but it can happen. That's what you've got to be aware of. Right. Yes. So then, if you acknowledge that any medication can cause a side effect, you've got to always, as a doctor, and indeed as a patient, you know, to be properly informed about it, make that risk-benefit analysis.
Right.
So if you're taking, you know, Ozempic, Wegovy for diabetes, We're doctors and patients all aware of the long-term consequences of poorly treated diabetes and the complications of that: heart disease, kidney disease, risk of stroke, etc., etc. Yes. So if you are better controlling your diabetes as a result of these medications, then, and it works, and you see the biochemical result that it is improving, then you are much more prepared to take the risk. That's to my mind, to most people's mind, that would be a strong benefit-risk ratio. Yes. Now, if you're then starting, though, to take these jabs, these medicines for, what do you want to call it? Not lifestyle, but broadly lifestyle, to make yourself lose a little bit of weight for you to look better. But there's not for a medical condition per se, then what is the risk benefit? It becomes much, much more finely nuanced. And, you could say, well, you are taking a risk without any, significant benefit, medical benefit.
Medical benefit. Okay. So here's the thing. How does the same doctor prescribe the same medicine for two different things? Is the narrative the same? Is it a lot? Okay. How do I put this? If I know I'm prescribing this for someone who is ill, who has diabetes, right? And I say, okay, this is what you have to do. Do you have to be on it for a certain period or whatever? And we'll get back to the time limit on that. Risks, benefits, there you go. If I'm prescribing it to someone for purely weight loss, do I still have the exact same responsibility to inform the client of everything there is to know about the drug?
Yes.
We do.
I mean, I do.
No.
Because I prescribe it for both. I do prescribe it for patients with diabetes and patients who also want it for varying degrees of obesity. Yes?
Okay.
So, but, if you are prescribing it and your name is on the prescription, then you are responsible for that prescription, of course, for informing the patient. And so in my mind, I would have the same conversation we've just had. That for, there is a risk of it, but for diabetes, I believe the benefit outweighs the risk.
Yes.
Now, I mean, same with all medicines, and sometimes patients say, no, I don't want it. I don't want this medication. That's absolutely fine. Then that's what I strongly believe in. That's called making a proper informed choice.
And that's beautiful. But I think and that's the thing when it's something is on a global scale, because of course there will be doctors who will always be 100% ethical, highlight everything and all that. I mean, at some point, Oxy was considered safe and non-addictive.
Yes.
Right?
Yes.
So are we on the verge of another case of Oxy? Or that's the whole thing. I don't think, or maybe people did speak about it before it even became a problem. I'm talking about Oxy.
Yeah.
But everyone started speaking after the disasters happened. So we're maybe trying to get ahead of it a little bit. We're saying, what are the bigger risks here if this is a population-wide thing? Because if it is prescribed by the government, everyone's going to ask for it.
Well, it's not going to be prescribed by the government. And being, slightly controversial, but pretty firm in my views, nor should it be. It would bankrupt the NHS. As a country, we're broke. Right. The NHS is even more broke.
Yeah.
So why should I, as a taxpayer, be funding somebody else to take a medication for a lifestyle to make them look better, in their words? And because if there's no medical need for it, I mean, that's not appropriate use of very limited resources, in my opinion.
No, 100%. But there's always a workaround, isn't there? Well, if I'm obese, and according to the NHS, everyone is morbidly obese.
No, it isn't.
I mean, the ideal weight, according to the NHS, is a bit ridiculous.
Okay, but it is allowed in the NHS for, I'm not sure if it's the right word now, but morbidly obese.
Yes.
Which we know has very significant health, poor health outcomes with a BMI of more than 35 is the NHS. I think in the States it's BMI
33.
Okay.
Because at some point, I'm considered morbidly obese, according to the NHS.
Okay.
And I would say that's highly controversial.
I would agree with you on that.
No, I mean, considering I have done all my blood tests and all my scans, I mean, so anyway.
No, but I mean, we've got to be careful of the NHS prescribing because they are so expensive. you know,
But you could say, well, if I'm obese now or heavily, not morbidly,
yes.
just a little bit under, well, shouldn't I take it so that I don't, to prevent me from eventually becoming sick? So take it as a precaution, on a precautionary measure even.
I would, okay, and you could make a case for that, Ahmed. I would also be controversial and say that as a culture, we have perhaps want instant fixes for zero cost to ourselves. We always want a rapid solution.
Well, zero cost if you're having it on the NHS.
Well, that's exactly what I mean.
Right.
That's
Yes.
what I'm saying.
Yeah.
And there is getting into dangerous territory, but increasingly a sense of slight entitlement that I should have it. Yes, not regarding the effect on the wider society, and perhaps not taking, if you're overweight, the lifestyle changes of looking very carefully at your diet and the exercise, as we've discussed before, and making those changes.
Yeah. It's very hard. It's exhausting.
Yes, it's tough.
It takes a lot of time and a lot of effort, and you want to give up every single month.
Yes.
If you really dedicate yourself to changing the the lifestyle, it's exhausting.
I agree.
And if I can take a shot,
well, okay, but then you're getting into. Personally, I don't think the NHS or that should be a government paid thing.
Perfect.
If you want to pay for it yourself, then absolutely fine. But then, and that's why I'm happy to prescribe it to my patients, but on the caveat that it is not without risk.
And I'm 100% in agreement regarding the publicly funded prescription of those drugs. But let's talk about the privately funded.
Yeah. Which is by far the biggest market in the UK.
Oh, absolutely.
I mean,
and make sure that everyone knows the pros and cons and all.
Yes.
If I go to the doctor and say, well, I heard about this and I want it, and he says, okay, well, is there any pre-checks that are done before I get prescribed this medication?
You need to. There's a few family histories that are currently not, and it's not for the pregnant ladies. Yeah.
Okay.
There's a history, a very rare theoretical risk of a rare type of thyroid cancer, which can be hereditary. So if there's the history of that in your family, no. But otherwise, no.
Okay.
Now, somebody should have basic blood tests before on kidney and liver function. Yeah, that's just routine in my practice, just to know everything is normal. But otherwise, no.
Okay. And once people on it, from what I hear, they have to be on it for the rest of their life. Is that true? Is that a lifetime medication?
That's the whole controversy.
Right.
Yeah, and that's, we don't know yet. When the first studies came out of this, it was for 2 years. Yes.
2 years?
Yeah, they were given it for 2 years and then stopped and suggested that should be the treatment for it. Mm-hmm. Yes. Now then, although when people stop, there's a very high rebound of weight gain back to where they were.
Because their appetite goes back to normal.
Yeah, and they haven't made the lifestyle changes. So they start slipping back into the old habits of the diet. Because ultimately, for the vast, vast majority of individuals, I'm afraid putting on weight is excess calories over calorie expenditure.
Yeah.
Over energy.
Yeah.
Yes. And so to reduce your calorie intake, that's cutting out the food.
Yes.
So, when people start feeling hungry again, yes, they start going back and eating
into the old habits.
So that's why the weight goes up. So there is going to be this discussion as to, well, should people stay on it long term? And then, and another factor I point out to my patients, we do not yet know the long-term side effects of it, or if any, or implications of it, good and bad. There's some potential studies showing that it can be beneficial for reducing cardiovascular risk. Yes, potentially there's a suggestion of Alzheimer's, dementia.
That it's good or bad?
Good.
It's,
yes.
Oh, wow. Okay.
Yeah. So, but we just don't know.
But is that normally, would you get that just if you lost the weight anyway?
You could exactly do. We could do all
right.
that. So.
Okay. So at least a minimum of 2 years.
Yes.
And then there's a reevaluation of whether someone should continue. How much does it cost, that medicine?
It varies. It's around 150 a month.
150 pounds a month?
Yeah.
I would imagine.
In the States, it's a lot more.
Yes.
There's a big discrepancy, and it's very controversial as to why the same drug is being charged so much more in the States compared to...
Well, in the States, they were debating whether or not it should be given to children, to obese kids, to reduce their chance of developing diabetes, and to give it to them for the rest of their life. So let's not go that extreme, because that is an extreme case, 100% an extreme case.
Yeah,
and again, if 570 billion are at stake, then you would lobby for it and do whatever you can.
Well, I don't know if they're necessarily lobbying for it, but they're being very quiet about saying you should stop at 2 years.
Yes.
Letting patients do their own sort of promotion of it, advocacy.
In a funny twist of events, there were, in some cases, they were saying if you don't prescribe it, that was in the US, if you don't allow it to be prescribed on the government, then you're racist, because it's minorities who are generally unfortunately have a bigger obesity problem. So you're racist if you don't. So I'm sure there'll be all sorts of ways to manipulate and guilt the governments into potentially paying for it. But back to our, private sector, where people can make decisions for themselves.
Yes.
So 100 to 150 pounds a month for 2 years.
Yeah.
Okay. You mentioned something regarding the effect on making us feel full.
Yes.
Quicker. So does that mean it affects something in the brain? You also mentioned that. Okay.
It affects the part of the brain, the tiny super control center, the hypothalamus, which controls many of our appetite, our thirst, libido, etc.
Food, eating, is one of the many pleasures of the human beings, right? It's to be able to eat, to feel that sense, to be full. That's a pleasure. It's a pleasure center in our brain. Does that medicine suppress this pleasure center?
To some extent, yes.
To some extent, yes. Do we know what happens, regardless of which pleasure center it is? Do we know what happens to our brain when we suppress a pleasure center for an extended period of time?
No. No, you mean whether it gets continually to be suppressed even if you stop?
Well, if it affects our mood, if it brings on depression.
Well, it has been associated with variations in mood. Yes.
Okay.
And that can be one of the side effects of very low mood. Yeah.
Okay. So that is that a large side effect?
I don't think it's a large side effect. And, if we're coming on to the side effects, then, because there's a lot of, almost to some extent, sensationalism about the side effects.
I'm sure.
Yeah. I mean, these drugs have been used, on millions of people now.
Right. Yeah.
Millions and millions of, patient years of treatment. Yeah. So we have a pretty good idea in the relative short term, of the side effects of them. Yeah. So it is very common, and many medicines are associated with the side effect, but especially these which affect the gut, of causing nausea. Yes. So nausea is about 20% of people.
Okay.
Yeah. You can then get actual vomiting, 5-10%. You can get diarrhea, around 15 to 20%. So those are by far the most common side effects. They tend to improve with time. As you take it, your body adjusts to it. They're also, like many side effects with medicines, dose dependent. So you should start on the low dose of these medicines and then slowly titrate according to your side effect, how you tolerate it, your biochemical response. Yes. Now, a lot of individuals getting it from less other sources, should we say, practitioners online, tend to start too high. Yeah,
okay.
Because again, people want that instant fix. I want bam, take it. I want to lose weight. Quick. Let's go.
Right.
Rather than letting your body adjust. So those are by far the most common side effects. Yes. And if they're particularly bad, occasionally they require people to be hospitalized. To recover from them. What I think is much more important are the rarer but potentially serious side effects. Clearly. Yes, and they very rarely it causes. I said it slows the motility of the gut. That's one way where it works.
Yes.
Occasionally, it can almost stop the gut completely, called an ileus, paralytic ileus. So the gut doesn't work at all.
Is that, how serious is that?
Oh, that's a major, major seriousness hospital admission, and that has been reported in some people to result in deaths from it.
So it can lead to death?
It has been reported, yes. But teasing out the exact mechanism of the drug and causal relationship to fatalities to death is not always straightforward.
I understand.
Because, the other rare side effect of it is something called pancreatitis, which is acute inflammation of your pancreas, which is the gland that releases insulin.
That can also be deadly.
Oh, yeah. No, it's a very, very nasty illness. So it can cause that. But pancreatitis is more common in people who are obese, per se.
Right.
And the other side effect of these medications is that it can predispose to gallstones. It affects the bile duct where you make gallstones.
Yes.
But if you get gallstones, that's a common cause of pancreatitis.
Oh, wow.
Yes.
Okay.
But gallstones are much more common in people who are overweight and especially females. So, it's difficult to know what is causal. Is it a coincidence? Yes, because they're so commonly used, these medications, that you are, by chance, going to also get people who suffer with gallstones and pancreatitis.
Right.
And you make this association that it's caused by Wegovy, Ozempic, but you don't necessarily know it's a direct link. It could be a coincidence.
Or are your body's predisposed, and this kind of nudges it off the edge?
It's all possible.
Right.
So it's not quite as clear cut. Fortunately, they are very, very rare.
Okay.
Those serious side effects.
They're very rare.
Yes. Or those serious occurrences of illness in people who are taking the medications.
Right.
Yeah.
Do you think a lot of doctors tell people that when they go to them to ask for it? They tell them your gut might stop. Is one in a million chance that this might happen. You might get pancreatitis that can be deadly.
I'm not sure. No. I mean, I do, but I don't know if others do. It will be on the drug leaflet. Patient information if people want to read that, but
I know
all too often people don't.
001 font.
Well, some of my patients read it, and because they have to list everything. But if patients, as always, want it to shed a few pounds, then they want the quick fix. They're not looking or thinking about it.
To be honest, and I know I'm kind of going back and forth because I haven't made my mind yet about it. To be honest, people go to bariatric surgery where there's 25 to 30% of internal bleeding.
Bariatric surgery is associated with much higher complications.
Very dangerous.
Yes.
And people do that purely for weight loss.
Yes.
So would you say this is maybe even a safer bet than bariatric surgery, which can be quite extreme?
Yes. Without a shadow of doubt.
Okay.
There's the acute complications of surgery, of quite major surgery, and then there's the long-term complications of bariatric surgery where you're not absorbing vitamins so well.
And bariatric surgery is elective, right? It's 100% elective.
Yeah. You mean, by choice and planned?
Yes.
Yes.
Okay.
Yes. You wouldn't have an emergency.
There's no medical conditions that make you go and have a bariatric surgery.
No, it's for weight reduction and the morbidly obese and the long-term complications of that. Yes.
Okay.
Yeah. So, so in balance, this is much better than surgery. As soon as you put a knife to anyone's skin, you've got a risk.
So many, absolutely. Okay, well, let's talk about the mental health effect, because I've been reading two conflicting kind of researches online. One that says that it has been associated with depression and negative thoughts. Let's put it at that, because we won't be allowed to say the real word. But then the same survey, a different survey said, well, actually, there's no link, and potentially these people were already depressed.
Absolutely. Could be, again, a similar thing with the complications. The other medical complications.
Both can be true.
Yes, because I don't think that the evidence from my study of the literature, is so clear-cut. They can be associated with mood changes, but, again, is it directly causal? Or coincidence, or already predisposed.
Correlation is not causation kind of thing.
Yes, exactly right.
Okay.
So I suppose, Ahmed, we're coming back to the same theme. They're relatively early drugs. Generally, they're very well tolerated and they seem to be safe, but there is possibly association with potentially very serious and fatal complications, and time will tell.
Time will tell.
It will all come out, like many things, it will all come out in the wash with more years of use.
I mean, you don't buy the very first model that a company car puts out. You wait until they iron out the kinks.
You could do, but it's again, as I was coming back to, people want this quick fix.
Yes.
Yeah.
So I'll ask you a question. If it was someone very close to you, or a relative, sitting in front of you and saying, Paul, what would you tell me about this drug, and what would your advice be for me? What would you tell them? Just in summary, if you had 1 minute to tell them everything there is to know.
A summary of this discussion.
A summary of this discussion.
They can be effective, but you should probably try more rigorously the long-term changes in lifestyle. Yes, the drugs can be effective. There is a financial cost to them. Yes, and they can be associated with significant side effects, rare, and very rare, potentially fatal.
Right.
You've got to make that decision. Yes, I would not be so happy if my family members wanted to be on one of these. I'd try and steer them away.
Okay.
Just because I think it is still relatively
new.
And I've been in a long time, and all medicines, when they're released, you need to wait many, many years.
Work out the kinks.
And things become apparent that weren't first apparent. That's the issue. Yeah.
Okay. All right. Well, I think on this note, we're going to end this episode. We reserve the right to potentially do a follow-up and perhaps interview a couple more experts on the subject. However, if you did like the episode, please like and subscribe. It really helps us, and it helps with the algorithm as well. For me, Ahmed, it's been a pleasure, and we'll see you on the next one.
Thank you, and goodbye.